Welcome everyone to the author interview of gastrointestinal endoscopy. I'm Li Zhen from the Department of Gastroenterology, Qilu Hospital of Shandong University, Jinan, China. I want to share our study, Optical Enhancement with Magnification versus White Light Endoscopy for detecting gastric intestinal metaplasia and neoplasia, a randomized controlled trial. As we know, the detection of gastric intestinal metaplasia, gastric intrabascular neoplasia, and early gastric cancer is very important for high-risk individuals with gastric cancer. The endoscopic pathological correlation and inter-observer reliability of conventional white light endoscopy are unsatisfactory. The optical enhancement system was recently introduced as an image-enhanced endoscopic technology. It combines digital signal processing with optical filters that achieve higher overall transmittance by connecting the peaks of the hemoglobin absorption spectrum. OE coupled with magnification endoscopy has been developed to examine the microsurface and the microsurface features of the suspected lesions. However, whether MEOE can detect more gastric precancerous lesions and early gastric cancer than white light endoscopy is unknown. Thus, we conducted a randomized control trial to evaluate the value of MEOE versus white light endoscopy for detecting gastric intestinal metaplasia, intraepithelial neoplasia, and early gastric cancer. In this prospective study, a total of 285 patients were finally analyzed. MEOE had a significantly higher gastric intestinal metaplasia per patient and per lesion yields compared with white light endoscopy in high-risk populations. MEOE showed better diagnostic efficacy in the endoscopic pathological correlation of intestinal metaplasia, particularly sensitivity, positive predictive value, and accuracy. In addition, MEOE could be a valuable tool to promote the observer reliability of endoscopic diagnosis. The advantages of MEOE may be related to the following factors. First, OE Mode 2 has a significant additional effect on detecting the color difference between normal gastric mucosa and mucosal abnormalities. Second, on OE Mode 1 with magnification, the light blue crest and with white light opaque substance can be easily observed in patients with gastric intestinal metaplasia. Third, identifying a demarcation line between a suspicious lesion and the background mucosa can assist in differentiating early gastric cancer from non-cancerous lesions. If irregular microvascular and/or microsurface patterns are present within the demarcation line, an early gastric cancer diagnosis can be made. These findings provide evidence for the diagnosis value of MEOE in the clinical practice of high-risk populations with gastric cancer. In the future, we plan to continue our research in the following aspects. First, this single-center study only focused on patients at high risk for gastric cancer. It is unclear whether the results can be extended to low-risk patients. Thus, the findings may need further validation in multi-center patients with different risk stratifications. However, the cost-effectiveness of patients with different risk stratifications is also of concern, especially in low-risk patients. Second, the observer agreements of the experienced endoscopists were superior to those of the inexperienced endoscopist in this study. Therefore, endoscopic experience and education are important to improve the diagnostic accuracy of suspicious gastric lesions. Simulation training is a promising modality that may aid in future endoscopic evaluation. Third, the European Society of Gastrointestinal Endoscopy recommends the operative link for gastric intestinal metaplasia assessment system for gastric cancer risk evaluation. However, implementing the OGIM system has been limited in clinical practice because 5 random biopsies mean more time and higher costs. Recently, a new endoscopic rating of gastric intestinal metaplasia, EGGIM method, was used to calculate and score the extent of intestinal metaplasia using narrowband imaging, and the results are strongly associated with gastric cancer risk. Currently, artificial intelligence and deep learning exhibit substantial potential for the recognition of upper gastrointestinal lesions in various endoscopic modes. Therefore, We are committed to developing a deep learning model for the EGGM scoring system to enable non-invasive optical biopsy and simplify risk assessment of gastric cancer. Thanks for your viewing.